vlog, and today I'm walking in Ruptungapetta. The walking I'm doing is because to get good health. The main purpose is to reduce the weight. But reduction of weight does not really happen with exercise alone. We all know that weight reduction does require dietary intake which is to be reduced. Actually, one can say we eat in dollars and spend in rupees. So, if you do exercise about 1 hour or something like that, you may spend around 300 calories. But, and if you eat 2 to 3 chapatis, that is upset. So, for weight reduction, the first and foremost thing is to cut down the calories. At the same time, there's one more thing which is important is you need to have intake of the food has to be protein form. Has to be also increased. ICMR, that Indian Council of Medical Research, has told us for Indians not to have carbohydrate more than 45% in their plate. So this is something very big change in the December 2024. The guidelines have come. So naturally, with this, we need to understand the carbohydrate is one of the major culprit for our ill health, especially lifestyle diseases. So how to come over this? To beat this, the first thing is you will need to increase your fiber intake. Fiber is like cucumber, green leafy vegetables, carrots. These have to be taken in more. The recommendation is around 500 grams per day. You can steam them and peel the upper skin to remove the insecticides and eat. So this will prevent absorption of glucose from the duodenum and helps the spike of the sugar that happens postprandial will also come down. Thus prevents the glycosylation and the damage henceforth. So for the better health, the most important thing one has to know is you need to have a good amount of sleep, at least 7 to 9 hours in the every day. It is perception is nighttime sleep. That's the most important thing. Sleep nicely for 79 hours, get up, go to exercise. This exercise will make you fit, but know that it may not reduce your weight. Weight reduction will come from dietary restrictions. This one we have to keep in mind. And the consistency, that is much more important. One more thing, if you are obese, when you start reducing your weight, what happens is, along with the fat burned out, your muscles also start burning out. And muscle loss is not good. So when you're reducing it weight, you see to it that you do some amount of muscle straining exercises. That's what we call as isometric exercises along with isotonic exercises. Isometric exercises are the one which are like weight bearing, pulling. Some things are called isometric exercises, and isotonic exercises are those where you really don't bear weight but you make a movement like walking. So this is also equally important. And further, your diet, which is very important. Although as the age advances, BMR, that is basic metabolic rate, comes down. So naturally, even if the basal metabolic rate comes down by a few percent, the need for the calories comes down grossly, because basic metabolic rate forms the 80 to 90% of the calorie burn. So when you age, the BMR comes down by a few percent. So naturally, calorie intake falls down drastically. These things we need to keep in mind. And if you're already diabetic or hypertensive, ischemic heart disease, stroke, or something, you better take care of this properly. Watch for the signs of hypoglycemia, which are very dangerous than the episodes of hyperglycemia. In the early stages of diabetes, some patients do fall into the trap of reactive hypoglycemia. That is, the body will secrete excess insulin for the small dose of insulin. So they may develop sort of a postprandial hypoglycemia. So this sort of a complication may make the patient to stay away from the treatment. We need to carefully evaluate them and consult the endocrinologist before dismissing treatment, or else you end up with the complications. Of course, there are some more related diseases associated with obesity. Obesity means body mass index more than 27 to 30. These patients can develop obstructive sleep apnea. What is obstructive sleep apnea means? Here, when you sleep, the pharyngeal muscles, the tone goes down, and you end up collapsing the airways. When the airways are collapsed, there will be obstruction to flow. In effect, the oxygenation of the brain whole night is not proper. It is like fragmented. Such a oxygenated brain will have suffer from many illness in the long run. These illnesses could be like stroke or ischemic heart disease, cardiac events, and many more. So, if you are snoring, better get your sleep study done from the consultant and rule out the possibility of you having sleep apnea. And always practice good sleeping patterns. Late night video seeing, late night blue screen, they are the one major factors which can distort your sleep. This is the one thing which I want to stress again. So please take care of your health, and that is for today. And tomorrow we'll come with some other interesting aspect of health. Thank you.